The broadcast is now starting. All attendees are in listen-only mode.
Hey, I want to thank you for joining the Power of Chronic Care Management today. In a very short time here, we're going to just kind of review why practices are finding chronic care management so important. At KeepWell, we see chronic care management as a way to keep close contact with our patient populations, with your patient populations. Most practices are doing chronic care management on some level. They're just not billing for it because they don't have the regulations in place, they don't have the teams in place, and they don't have the clinicians in place to do so. Medicare says that 1 in 4 patients have 2 or more chronic conditions. These are the patients that in a practice take the most time to work with. And it's usually ancillary staff that's working with them. 1 in 4 patients are eligible for chronic care management. This is what Medicare is saying. Now, if 1 in 4 patients are eligible over the whole United States, even more patients are eligible in rural areas because we have more of a rural population that has 2 or more chronic conditions. So if you're in a rural area, which most of us are here, we're going to see a higher population, a denser population of people that need the services. So why, if you're doing it in your office, why do you need KeepWell to help with this? First of all, we make sure that we're meeting all the Medicare requirements. As that it's a Medicare program, they have requirements, just like we all know, right? Anytime Medicare is paying for something, there's always requirements. But these requirements, we make sure that they're all met, including a licensed staff member that we place with you. These types of services, most patients see as a VIP service. And really it is, because these are the patients that we are stratifying, that we're saying, hey, we're going to offer you a higher level of service because you have 2 or more chronic conditions and we want to make sure you stay healthy. In this day and age, especially with COVID, this is becoming increasingly more important. We see people are fearful. Our care coordinators can work with them to make sure they're meeting their healthcare goals and preventive goals. This is a big deal. Patients are not getting preventive services, and that's worrisome. That's worrisome to all of our practices and to all of our physicians across the board. Chronic care management for a practice will also help sustain the practice because it will help build the practice, keep the contact with the patients even closer, a higher touch, and provide additional revenue. With KeepWell, we see this as what I call a zero-sum game, because when Medicare pays, this is a paid-for Medicare program, in turn, you pay KeepWell for these services. So we work in conjunction with you. Patients call us, we call patients. Sometimes it's even family members that are saying, hey, I'm worried about mom, she's isolated. You know, she's getting her medications, but she's confused. We've had calls like this from family members. Medicare even allows us to work with family members, and that can be billable time. I really do see beyond COVID and in the future, these higher touch services are going to be even more critical to every single practice out there. We see physicians' income is drastically increased with the use of these type of value-based services. Annual wellness visits, chronic care management, behavioral health integration. There's a number of different services that we help integrate into your practice. These types of services are where Medicare is pinning a lot of emphasis to. These are the services that will help sustain and build your practice at this point. We invite you to join us. We want you to reach out, to call or text for more information if you're not familiar with the program, or if you need to increase the type of program that you have right now. We're happy to help with that. I do not know any primary care practices right now that should not be taking advantage of this type of program. Even virtual practices are doing it. People that are doing virtual medicine only because of COVID, they're integrating these type of programs. So give us a call. I want to thank you for your time. I hope this helps explain a little bit why chronic care management is so powerful in today's day and age. Thank you.